So how often we have been told of the things we should do and should not do about life, education, health, savings, savings for health, because that's the biggest expense these days. Every morning after the alarm, we get messages of the list of things we should do, should not do, what to eat, what not to eat, which diet to follow. It makes one wonder, actually it is leading to a healthcare change or a behavior change, or is it adding to the to-do list and bringing us more anxiety? Health messages have been going on for a long time. We all know about the smoking healthcare messages. The images are becoming gorier, the fonts are becoming bigger. Every movie starts with a very sorry story of a person whose life has been affected by smoking. But at the end of the movie, how many of us actually remember that message? We just forget it. Maximum what we can do is we enter the hall late so that we don't have to see it. Do we actually have a behavioral change? But does that mean that people don't understand what is needed? Everyone does. Everyone has a basic instinct. But then why don't the people follow? It's just the way the information is being given, the way it has been communicated, anxiety-provoking, fear factor. Maybe that's not affecting me somewhere. To understand that, we started doing a study in 2009 with the HIV/AIDS people, where we went to the people's houses and understand their ecosystem, the kind of problem they have, the kind of information they have regarding pill-taking behavior, regarding their condition. This was a study which was initiated by the IDC, IIT Bombay, Johnson & Johnson Global Public Health, and some of the leading HIV hospitals. The idea was to give them a pill reminder, to make them regular and adherent towards the pills. But when we went and talked to them, we realized that it is not that what the pill reminder that they want. The problem was that they didn't know why they need to take the pills. Will that eradicate their disease? Will they make me more informed, healthy? Can they live a healthy, normal life? Can they have a normal life, get married, have babies? So it made us realize it's just not the pill reminder. We have to do something else. So we again came back and designed a system which had the pill reminder, the side effects, and this was an IVR-based only voice messaging system which works on a very basic phone because these people, they stay in a very resource-constrained area. When the system was designed, it had 3 features. One was a pill reminder, then the side effects, and the health tips, where we collected all the questions that they had asked and tried to answer them, articulate them in a very conversational and communicative way. This was then given to the 54 HIV patients as a pilot study, where they would listen to the messages, and I don't know what they will do. So it was given to them for 3 months, and we didn't know what was happening. After 3 months, when we get the result, so the first thing that was most motivating was a person who comes from a remote background, saying that this is something where you get the only authentic information, and this is the only source of information that we have from this. There were people, almost 50 to 60% of the people were listening to the messages, and it was creating an impact and a positive behavior. That is something that we realized that some kind of change is taking place. The study started in 2009, and it's still 2019. From just the questions, we came back to designing 32 health tips, which were launched and taken by the MDAX Mumbai, and it has been circulated with almost 2,500 HIV patients. And currently, almost 52,000 messages have been held by these people. But is it creating an impact in some way? Not much, maybe. A very small one, maybe. Because to change become a miracle, it takes almost 20 years. So we are still waiting for the impact to come. Where we decided and we understood the kind of messages that needs to be designed, what also important is that the way it has to be designed, the visuals. What are the kind of visuals that people would like to see? They could connect with culturally, locally. So to understand that, we again conducted one more study, which is going on. It started 6 months back in the slums of Govandi, where the idea is to give them informative and interactive video CDs. And it's an ecosystem that has been digitally designed to tell them about their nutritional health care. So the videos has to be very interactive, very informative, at ways of very culturally rooted and engaging. So we went to the people and asked them that what kind of characters they would like to see in those videos, what kind of images they would like to have. We had some images about animations and characters because everyone feels that whatever you design should look good, and it looks good. It's good that we went and asked them because the feedback that we got from them was completely different. What we bought in the sari is something was supposed to be outdated. A lady whom we thought was resembling a nani, a person who gives messages. She had specs, and these people, they thought that they look very khadoos. What about the people? When we thought that we want to design a mascot, we thought that we will take ideas from a college-going smart girl whom they could relate. But their comment was that this was a very short, and they didn't want someone with specs. Their idea of a mascot came from the daily soaps of what people would like to see and the aspires of the samajdar ladki that are there in the serials. Same was for the men. If a person is a completely well-dressed, nicely designed, neat and clean, they would appreciate that. Whereas a person whom we thought was from a rural background looked very outdated. So what we understood was it is not what we perceive as they think, what their understanding is. And they need to somewhere resonate to these characters, somewhere culturally know these characters. Somewhere there has to be an aspiration that, okay, this is the kind of family we would like to look up to. Main thing was the character of a baby. We felt this was very cute, but this reminded them of a malnutrition children, and it was an absolute no-no. So the artist, he went back and understood what their requirement was, and then he designed all the things again. And currently, these are the characters. This is a program called Saath Health, which is going on in Govandi slums. And currently, there are 40,000 registered users in this, and with a session time of 7.5 minutes. This is the animation that's the most liked one.
ये खेल रहा है, मैं तो बस नजर रख रहा हूँ।
तो आप भी तो इसके साथ खेल सकते हैं।
मगर इसका कोई खिलौना नजर नहीं आ रहा।
खिलौना है ना, इसके हाथ में।
ये तो गत्ते का खाली डिब्बा है।
इस करची के साथ ये ढोल बनेगा। बच्चों को कीमती खिलौने नहीं चाहिए, बस रोजमर्रा का सामान और आप जैसे सयाने माँ बाप। साथ खेलने से बच्चे का दिमाग बढ़ता है।
व्रूम व्रूम।
अरे ये क्या हो रहा है?
मुन्ना कार चलाना सीख रहा है।
अब ये ट्रेन है।
So this is the animation that has been maximum viewing and the maximum impact in that. But a work of a public health is not something which can be done by only one person. At every moment, there's a huge team which is working constantly on different aspects of it. Very few of us actually get a time to go and talk about the work, but this is a daily job. But is it creating an impact? Is it working on it? People are still working on it. It's an ongoing thing, and every public health is like targets to millions of people, where we are still sticking with only thousands of it. Public health is described as the science and art of preventing diseases, prolonging life, and promoting health through organized effort and informed choices. To design a proper prevention, it's been commonly known and accepted that prevention is better than cure. To design prevention, we should have the informed communication design. And to have a good communication design, it's very important to go and listen to what people are saying, because there are particular voices who need to be heard, and whatever they hear, we need to design it accordingly. Thank you.